Welcome everyone to another edition of Up the Ladder podcast. I am Dr. Endel with Westerville Chiropractic and Nutrition, and each month it is my goal to inspire you and take a deeper dive into a health topic that I think is going to push you up the ladder of health. Today we're going to be talking about mobility, and specifically a little bit about what it is, but more importantly, how you can measure it yourself. I'm going to go through a couple of things that we do in the office to measure people's mobility so we get an idea of where we're starting at. So I'm going to go through 4 points that you can improve your mobility because it's so vital to your overall health today. And so number one point is to find your faults. Okay, you can't track or improve something that you're not measuring. And so there are 3 exercises that I would highly encourage you to either yourself videotape them, of yourself doing them, or have someone else take a videotape of you doing them so that you can get an idea and you can see yourself. So often as we're doing an exercise, we think this looks good, this feels good, but if you actually look at yourself on video, you can see that you are not getting the correct range of motions, you're not getting the right angles, and you're setting yourself up for injury, and you're not maximizing the benefits of doing a lot of the exercises in the first place. And so number 1 movement that I would recommend you doing is shoulder mobility test. And so I'm not going to do a lot of demonstration on this on the podcast, because it's hard to demonstrate on audio. But what I will be doing that you can be on the lookout for is I'm going to break all of these up into shorter bite-sized videos, which will be up on our YouTube page, as well as our Facebook and probably Instagram pages. So be on the lookout for those. So I'm going to talk you through a lot of these and be on the lookout for the video editions of them coming up shortly. So the first one is shoulder mobility. Essentially, you're going to make a fist with each hand. You're going to take one arm over your back, like you're scratching your back. You're going to take the other one around your back the other way. So it's going to look, if you are watching on a video, something like this. You're going to do the opposite side as well. And you want to measure how close you can get your hands together while keeping them in a fist. That tells you a lot. You're going to be surprised at, wow, one side is maybe a lot more tighter than the other side, and you should be able to get those within a fist length of each other. If not, then you've got some shoulder mobility issues, which is so common, especially right now. Everyone is at home working, and we're set up in horrible workstations on your couch, at your kitchen table, at your bar, and no one's in the right chairs, no one's got the correct height for anything, and that's been going on for pretty much a year now. And so that leads to a lot of shoulder, neck, upper back issues. And so this is a great mobility test to begin to demonstrate and see where you're stacking up on those areas. For each hand width that you're apart, you want to, like I said, track and measure. You want to do this test, work on some shoulder mobility tests that we'll go through today, or that I'm happy to offer and give you, and then retest in 30 or 60 days, and those should be closer. If not, then you need to take a deeper dive into what you're doing and what's going on there. The second mobility test that you should record yourself doing is a squat. And so ideally your arms would be straight up in the air. Your feet and hips are shoulder width apart. Keeping your feet flat on the floor, you come down into a squat as low as you can. And you are going to be amazed at how many different things that you can pick up if you are looking at yourself from the front and also from the side while you do a squat. What are your knees doing? Are they collapsing in? Are you just completely falling forward? Are you able to keep your shoulders up? This is one of the biggest, most important tests that I do with pretty much every new patient that comes into the office, as long as they can do a squat, is we take beginning measurements of where someone is starting at on a squat test because we see the entire system from feet and ankles all the way up to what their head and neck is doing, their shoulders, their mid-back, lower back, hips, knees. Like I said, feet and ankles, which is the foundation of a lot of this. And we can begin picking apart why someone may be having lower back issues and how that's connected to the feet and ankles, or head and neck problems could be causing, you know, just a slew of other types of issues. So I love the squat test. If I had to pick a one, it would be the squat test. Now, I'm not suggesting that you try to necessarily diagnose certain, you know, underlying issues or injuries that you've got on your own by doing a squat test. Certainly you can, but at least you can get a sense of, again, where you're starting at, what you start to notice by looking at yourself. I think knowledge is super important. Being able to identify for yourself how you feel and how you look, making that connection is absolutely vital. The third one is doing a push-up and recording it, because I guarantee you a large majority of you are going to get into a push-up position, you know, go down and try to do a push-up, and you feel like you're straight, but actually your butt is sticking up in the air, or you're really arching your lower back. You know, there's, again, a handful of different things that you can really pick up, predominantly core stability wise, glute wise, and between your shoulders, what could be happening that would improve overall mobility. And again, as you start to work through more stretching and more mobility moves, those things should start to improve and increase. So the first step is just getting an idea. If you do this and you really have absolutely no idea what you're looking for, and you want some help with that, I'm happy to connect with you over a Zoom call or in the office. We can do these tests for you. We can even record them on your phone, and I'll walk you through what I see on them. And then we've got some amazing cheat sheets that, you know, we can circle, you know, what patterns that you are showing, and then what that means as far as it means these muscles are weak and these muscles are too tight. And then we start to build a program around correcting and balancing those. And so as you look at these types of problems or these three tests, typically what I'm then grouping people into is, you know, do you have what's called an upper cross syndrome? Do you have what's called a lower cross syndrome? And that's probably a whole nother video or another podcast is just looking at those two things. But upper cross is the classic, my head is forward, my shoulders are rounded. You're going to see a lot of tightness in the chest and in the trap area at the top of your shoulders. You're going to see weakness between your shoulder blades, which is allowing those shoulder blades to begin to move forward. And so that's the upper cross. Lower cross, you typically see where the hips will begin to kind of round forward. People will lean and arch their back a little bit. Predominantly, that's going to be a weakness in your abs, a weakness in your glutes and hamstrings. Your lower back is going to be tight, and the front of your legs, the hip flexors, the quads, what's called a psoas muscle, will typically then be too tight. And that leads to a lot of lower back and lower back issues, lower back pain, hip problems down the road. And so, you know, as I'm doing these screening tests, as a chiropractor, what I'm really focused on is where do we see joint restrictions at? What joints aren't getting those full ranges of motion? And then what is that? What kind of pattern imbalance muscularly is that relaying? And then, you know, we start to work backwards from there, because if we can restore joint mobility, if we can correct these bad patterns, you know, the muscles that are too tight, the muscles that are too weak, if we do those two things, then we should see significant and dramatic improvements in how you're feeling and how you're performing. So number one is find out where you're starting at. Number two And again, this is going to be a whole nother video because this is vitally, vitally important if you're doing any kind of lifting exercises, but it's crucial for proper posture, for proper sitting, for proper standing. Another thing that we do when people come into the office is look at posture tests. So I'll take posture pictures from the front and from the side, and we'll measure how far forward the head is over your shoulders and how much weight that is putting on your spine and on your shoulders. But the next thing you want to look at is be able to find neutral. What is a neutral standing or a neutral sitting posture look like and feel like? And so we're going to be going over some, again, with another video, some deeper diving into what neutral really means. But often what it looks like is tight muscles, or there's an immobility in a joint. This joint immobility causes adhesions, and so you're not getting you're not able to get full ranges of motion. We're looking for good total movement mechanics. As you try to move your joint and you're putting stress in specific areas, you're probably, so as a joint is, if you're not getting proper motion in a joint, your body tries to protect that by tightening an area up. So oftentimes when you see a muscle imbalance, when you have really, really tight upper back muscles or really tight muscles between your shoulder blades, there's a couple of reasons that that's going to be happening. Number one is the joints aren't getting full ranges of motion, so you're putting more stress on those muscles. The second one is the muscles could be weak. Oftentimes we'll say that a weak muscle or a tight muscle is a weak muscle. And so if you are not getting those proper ranges of motion, your body is trying to protect that area. And so classic example is if you're doing a squat and you get to a certain point in that squat, you start bending forward, right? We're seeing all three of those issues. You're not getting the correct joint range of motions, and so your hips aren't getting, you're not getting deep enough in your hips, and so you're leaning forward in your lower back. Your lower back muscles are tightening for two reasons. Number one, they could be weak. Number two, they're trying to prevent you from injuring your back, and so they're clenching down to stabilize that area and prevent you from doing damage to a joint. And so if you are able to find this correct neutral posture before you begin an exercise, or while you're doing something for an extended period of time, like sitting all day at your desk, if you're able to take a break, excuse me, and find that neutral position through the day, it takes a tremendous amount of stress off the muscles and the joints over a long period of time. And so finding neutral is extremely, extremely important, and it doesn't feel natural to start with. And so there's a phenomenal book called Supple Leopard, or How to Be a Supple Leopard, that I highly recommend. It's a phenomenal mobilization book. It looks like a textbook, but it's actually a prescription for anybody to begin to work through injuries and work through just a preventative maintenance program on stretching and mobilization. Kelly Starrett, I think I'm pronouncing his name correctly, is the author of that book. I highly recommend it. And he does a phenomenal job at showing pictures of what finding this neutral looks like. So step one of that, finding neutral as you're standing, is what he describes as screwing your feet into the ground. And so oftentimes when we have people just stand naturally and normally in place, their feet will be turned outwards, their arches will collapse in, which ultimately then brings the knees more towards the middle, and then also your hips will start to come forward. That's most people's natural and normal posture, and that's why we see so much issues with the way people squat and causing issues with knees, hips, lower back problems. So doing the opposite of that, where you're basically start beginning to, kind of, not actually moving your foot, but adding torque to your feet in an outward position, the knees in an outward position, and really focus on, centering your feet so they are planted into the ground firmly. The second thing would be to squeeze your butt. When you squeeze your butt, you then bring your pelvis back to a neutral position. And as you do it, you'll be able to feel yourself, wow, my hips actually begin to come backwards. Third one would be to take a deep breath in through your diaphragm. So you're going to take a deep breath, but you're not going to breathe from your chest. You're going to breathe through your belly. And as you take a deep breath in through your belly, you want to bring your rib cage back over your diaphragm and balance your rib cage over your pelvis and tighten your belly. As you do that, you're going to correct the posture of the slouched shoulders. And then as you start to bring your ears back over your shoulders, that is what a neutral position and posture looks like. And for some people, you can't get there because physically you've been in such a hunched forward posture and position for so long. But the more that we can practice getting you in what would be that normal position, the better. For people who have a lot of arthritis or degeneration in the neck, upper back, or anywhere in the spine, and they're having trouble reaching this, oftentimes I'll also have them do the same sort of motions, but laying flat on the ground. And so now you're not having to work as hard on gravity and some of these tight muscles to begin that. Now, obviously, you're not going to be able to anchor your feet into the ground if you're laying down, but the rest of what's happening with your pelvis, your shoulders, and your neck and your upper back, you can begin to do also laying down, which may also take some stress if you're having any type of injuries or problems right there. So again, this is very hard to describe over audio, all over a podcast. So be sure to be on the lookout for our YouTube channel or Facebook, where I'll be diving and visually showing you how to find what's a correct neutral posture as you're sitting and as you're standing. The third aspect of mobility that you may not have in mind is breathing correctly. Breath is really the foundation for most of your movement patterns, because pretty much any motion that you're performing should actually start in the deep pelvis, inside the deep core muscles, and then those patterns start to come out. And if you are not engaged correctly with the diaphragm, with your deep pelvic and core muscles, then that's where a lot of these patterns, and again, ultimately injuries and deterioration and degeneration of joints and spine really stems back from the beginning. If you take a look back from the root cause of a lot of these issues, it's going to be people not in a neutral position, which we talked about just a second ago, and then not having a correct breathing pattern. And so there's a lot of different muscles that you're not aware of that are affected as you're breathing. Diaphragm, of course, your scalene, which is your neck muscles, your deep pelvic floor muscles, actually deep, deep spine muscles in the back are also responsible for opening up and helping the diaphragm and the rib cage expand as you're breathing. And so a quick test to be able to tell if you're breathing correctly is to lay flat on the floor or flat on your bed. You put one hand on your belly, one hand on your chest. You take a deep breath in and you see which hand is moving in which direction. for a majority of people, I think only 12% of people actually breathe correctly in the United States. So for a majority of people, what's going to happen is the hand that's on your chest is going to raise first, and maybe the stomach will start to raise a little bit, but predominantly most of it's going to be coming through your chest. And so you're going to be doing what's called clavicle breathing or chest breathing. And that leads to, not being able to get a full inhalation in the lungs, which is not healthy or not good. But it also leads to, again, poor posture, being hunched forward, not engaging and not balancing both parts of your nervous system. So your sympathetic and your parasympathetic parts of your nervous system are deeply connected to breath. And that's why doing breath work is vital for reducing stress and anxiety. If you're doing this deep abdominal breath work, you're stimulating the diaphragm, which promotes the parasympathetic part of your nervous system, which is going to combat the stress and anxiety sympathetic part of your nervous system. And so taking a look at, again, as I'm breathing, where am I breathing from? And then, again, just reverse engineering that. What that looks like doing would be sitting or standing and putting a hand on your chest and your abdomen and just taking 20 deep breaths in, really focused on making sure that the abdomen and it is expanding not just in the front, but almost like a barrel on the sides as well. So if you put your hands on your hip and then you take a deep breath in, you should feel your whole hand coming out, not just the front of your belly, but you want to expand from your abdomen in all directions. If you're doing that, then you are stimulating the diaphragm in the correct way, and you're able to get all the benefits of improving mobility, improving the deep core and pelvis muscles. You're getting the benefit of balancing out your nervous systems. There's so many positive benefits that happen from just doing some additional breathing exercises and focus on abdominal breathing. I really can't overstress this enough. Most people don't do it because it sounds too simple, but sometimes it's the simple things that make the biggest difference for us. I've been really focused on that, breathing exercises and doing some work in this space the end of last year, beginning of this year. I got turned onto a really amazing book called Heart, Breath, Mind. I forget the author, but she talks in much more detail and in depth about this concept of how your breath is connected to mental clarity, stress and anxiety, emotions, emotional health, and also something called HRV, which is heart rate variability. Heart rate variability is deeply connected to longevity and is a phenomenal predictor of overall health. And so she outlines, I believe it's a 9 or 10 week program that is in this book where you can improve your breath work, which is going to balance out your nervous systems and ultimately significantly improve that HRV. And so I've been incorporating this breath work as much as I can into my training, into my daily routines as much as possible. I use a heart rate chest strap as I'm doing this, and then connecting it to an app called Elite HRV. You can sync those two things up and in real time see what your heart rate variability is, as well as just your heart rate. And you can see as you do a 15 or 20 minute breathing exercises, what happens to that heart rate and your heart rate variability, and how that improves. So it should improve through the 15 or 20 minute session, but also as you're doing, consecutive sessions, you'll see that improving over the course of, weeks. I can't speak highly enough. She speaks on something called resonance breathing, which is breathing in through your nose and out through your mouth at certain frequencies. So for instance, what I typically do is in to a count of 4 and out to a count of 6. What I love about this app is I'll put my headphones in, I'll put in how often or how long I want to do my breath work for, so 15 or 20 minutes, and then you can set it up so that it tells you when to breathe in and out. So I'm not having to count in my head and then think of 10 other things and figure out, keep my mind in gear and try to remember, was I breathing in or out? You just listen to the app. It tells you when to breathe in, tells you when to breathe out. It's deeply, deeply relaxing, and there's so many health benefits from it. And most people don't understand how deeply connected breath work is to mobility. And so the third point that I want to get across today is making sure you're doing abdominal breathing and you're not stuck in chest breathing mode. And so the last bit of this, the last pointer for you for increasing your mobility is really to develop a plan. And so a big factor in developing a plan is obviously making sure that you're doing the mobility moves correctly. And by mobility, I don't just mean doing stretching. Sometimes, a lot of times, it is stretching, but it's also using a foam roller, using tennis balls, using different types of tools to lengthen muscles and ultimately improve range of motions and what you're able, the mobility that you're able to have in specific joints or areas of the body. And so you want to build a systemic approach, a systematic and a systemic, meaning you don't want to do the same 5 stretches for the same 5 muscles all the time. And that's all you do. You stretch your hamstrings and, you do these hip exercises, and you do that every day, or you do it several times a week for the year, right? Like that's not a good way at building a program that's meant to improve. It's a great way to just check something off your list each day or each week, but it's not a great way to actually improve your overall health and mobility. And so what I would recommend doing is 10 to 15 minutes either every day or every other day, or at least 3 or 4 times a week, and rotate around what body parts you're doing. You should be doing mobility and stretching and muscle work on your feet. You should be doing it on your calf. You should be doing it on the inside of your legs. You should be doing it on the front of the legs, the back of the legs, your hips, right? All of those areas, there are different stretches, different mobility moves, different ways to use a foam roller, different ways to use a tennis ball. And there's phenomenal books. Like I said, Becoming a Supple Leopard is probably the best. I'm sure there's some exercises and videos. YouTube's a phenomenal way to mix it up. In fact, I've got a DVD that I put together with an exercise instructor in the area where I walk you through every body part, head, neck, shoulders, middle back, lower back, hips, all the areas. I want to say there's like 19 different areas that we discuss and cover, and how to use tennis balls, how to use a foam roller, how to use bands, the great stretches for these areas. And so I have it all on a DVD that you can just click on the body part and move through it. If anyone reaches out, calls into the office, emails, I'm happy to just send that DVD. If you're not around here, if you just pay for shipping, I'll send you that DVD so you can take a look at it and start to implement these ideas while supplies last. I probably have, 15 sitting at the office right now. So if you're interested in one of those, mention this, reach out to us. I'm happy to hook you up with that DVD. Otherwise, there's a lot of other great resources out there, and I'm happy to point you in the right direction. The last tidbit I would recommend would be to anchor this mobility to something you're already doing. The easiest way to make it a habit is to anchor it to something else you're already doing. So if you're already exercising 3 or 4 times a week, anchor after your exercise doing an extra 10 minutes of just some easy mobility work for a different part of your body. If you're not exercising 3 or 4 times a week and you want to improve posture and improve mobility, anchor it to something you're already doing each day. So if at 3 o'clock you take a break from work to grab a cup of coffee or a cup of tea, while you're waiting on that tea or coffee, anchor these mobility moves and exercises to that 3 o'clock break. Find something consistent that you're doing each day or multiple times through the week and simply tie these 10-minute routines to something that you're already doing. That's the easiest way. Set a reminder in your phone. But honestly, if you actually want to create the habit, you need to anchor it to something. And so that's already a habit. That's one of the easiest and best hacks that I've found for myself is if I want to make something a habit, I just anchor it to something else I'm already doing. And so that way you can begin to stack these habits in a positive and healthy way. And so that's it. That's what I've got for mobility. Mobility is extremely underrated. If you took the time to get serious about improving your flexibility and mobility, I tell people there'd be a lot less people coming into my office if they got serious about doing these sorts of things, because you're going to prevent injuries from happening in the first place. You're going to begin to be able to reverse a lot of this. It's going to make my job a lot easier as a chiropractor, because now you're coming in and we're able to actually just work on the joint mobilization side of this, as opposed to figuring out all these other muscle imbalances and helping you with that as well. So, which I'm happy to do. However, you're going to be taking your health a lot more into your own hands if you're more proactive in what you're doing here. So as a recap, number 1, find out where you're starting at. Videotape yourself doing a couple of these exercises so you can see what you're doing well, what you're not doing well. Reach out if you have questions in analyzing that for yourself. Number 2, find what neutral is. Be on the lookout for the videos that I'll be having coming out in the next week or 2. Number 3 is focus on deep abdominal breathing and breath work in general. And number 4 is develop a plan to address your whole body in a mobility-wise and improving that. As always, I'm so glad that you joined me today. If you have any questions about anything we've gone over, don't hesitate to reach out. Otherwise, we will see you next time.